push the green button, okay. I'm going to do that.
Teamwork.
Great team.
I'm really working at an advantage here because I can speak only about half as rapidly as Tim Carpenter. So I really ought to be given a little bit of leeway because I need to be able to get a little more in. But I want to report that we are now at 597 unions that have endorsed H.R. 676. That campaign began in 2003, shortly after Congressman Conyers, with the work with PNHP, introduced the bill. We've been working on since then because we believe face-to-face, at the rank and file, at the grassroots of the labor movement is where we build the understanding to move this forward, and that we will not get there until our labor movement leads this battle to remove the profit making from our healthcare system. I think one of the key things that we have to do is tell the truth about the ACA, the Affordable Care Act, the bill that was passed in 2010. The problem is, so many people have been afraid to say really how much it will fail because of their concerns for other political situations. So now that the election is over, let us tell the truth. This bill, the Affordable Care Act, will not bring us care, will not control the costs. Under it, our crisis in healthcare will continue to escalate, and we need a new solution that moves us forward rather than backward. And that hasn't been in the mainstream discussion. We have found that too many on the liberal side have spent their time trying to apologize for it and say, over 10 years, you just have to get with us and help it to unfold. And when it unfolds, it's going to get better and better and better and better. And you know, the sad thing is that it's not, and we've really seen that it has not gained, no matter how much some of them push it, it has not gained in popularity. People love the parts of it that would curtail the insurance industry. They hate the parts that hand over billions to the insurance industry. So, but the problem is that it's not a workable foundation, that with the profit-making industry at the core, we cannot make it work. You know, one of the interesting things that we've seen through this campaign is that we have MIT economics professors and all these folks who are looking into, how do you do universal care and control costs? And we just don't know, you know, this is something that has to be examined. And so they wrote into the Affordable Care Act a number of pilot projects so we could test it out. Maybe we could see how we're going to cut the costs. Now Jonathan Gruber is saying, well, you know, we just expanded care and later on we're going to figure out how to control the costs. Well, the truth is that the rest of the world knows that goes by science and goes by research and goes by policy, knows that there's a way to cut the costs and expand the care, and that's by using a publicly funded system, removing the private for-profit industry, and assuring that everyone is covered, and having a system like the rest of the industrialized world has. We've seen those pilot projects that they wrote into the bill, one by one, go under, with the research showing that the bundling doesn't work and that the chronic disease management doesn't save any money. And on down the line, the health information technology hasn't saved us any money. Think of it, billions, billions, billions. And it hasn't saved the money. And we know what will save the money, and even President Clinton has told us what would save the money. Now this is amazing, you know, he could have done us a favor and said this in 2009 when it would have helped. But in 2011,
Or 1992.
Bill Clinton said that if the United States adopted the healthcare system of any of the other industrialized nations in the world, we could save $1 trillion a year. Huh? I mean, think of that in comparison to the fight we've been having over the fiscal cliff. They're talking about $600 billion over 10 years, or $1.2 trillion over 10 years. But here we are, $1 trillion a year. That's the kind of money. We can't solve anything else until we can bring the costs under control. The other thing is that Marcia Angel, who's the PNHP physician who spoke on this and was with the New England Journals of Medicine, has told us that under our profit-making system, you cannot cut costs without cutting care. Period. It doesn't work. They can stop the pilots. They can go to finding a system that works. The only way that you can control the costs is to remove the profit-making industries, the hospitals, the insurance companies, etc., from the system. The other thing, I want to talk about 676 because it's the best bill and it's the one we should stay with. I know that there are other bills that have been introduced, but the other bills exclude the undocumented workers. That is a very, very dangerous thing for our movement to embrace. We have to have everybody in, nobody out. It's a principle. And secondly, we have to exclude the profit-making hospitals. We know the quality is lower. The quality is lower, the price is higher, they will gouge us and suck the money out and hurt our patients, and they have to be excluded, and that also is in H.R. 676. It has the progressive funding. Okay, I have with me resolutions on H.R. 676 for your union, and I also have another one here for you. I think that it's important for us to have the confidence that our people can be won to these ideas. We've been to every single Central Labor Council in the state of Kentucky. There are 8 of them, and we've won support for H.R. 676. People are ready to do it. This is a resolution from McMinnville, Tennessee. That county has endorsed H.R. 676. So I want you New Yorkers to come and get a copy of this. Because, folks, you're going to lose your standing at the head of the progressive movement and let McMinnville get ahead of you. But the point is, we can reach people across the nation, everywhere. This issue touches the hearts, and we can win on this battle. Thanks.
You did very good. The light went out. I just want you to know it was Kenny that did it.
I didn't even see it.
You did great.
Okay, so now Rachel.
You're a technical wizard.